My name is Michelle Ploughman. I am a physiotherapist and a neuroscientist, and I'm an associate professor in the Faculty of Medicine in Biomedical Sciences, and I'm also a Canada Research Chair in Rehabilitation, Neuroplasticity, and Brain Recovery. Our work involves probing the brain from the outside in. So really trying to understand how the brain can modify itself and repair itself after injury. Two diseases that we focus on are stroke and multiple sclerosis. So stroke is a disorder in which the brain is attacked really by a loss of blood supply that's sudden. So the repair happens over a period of usually 3 to 6 months. Multiple sclerosis affects younger people, and the lesions are smaller and they build over time. And we're really interested in how this brain can stay healthy and functional over the long term. We're really interested in aerobic exercise because we know that fitness confers so many benefits to all systems. One of those systems is the central nervous system in the brain. So we examine how fitness and aerobic exercise increase blood supply to the brain, improve cognition, and help brain repair in these two disorders. My work is innovative because a lot of it is the tools that we use. I will call it deep clinical phenotyping, which means that we try to understand using specialized tools how the human body is repairing itself. So we can use non-invasive methods of brain imaging to look and see what areas of the brain are active. How does our intervention affect brain networks? So we can look at the brain. We can look at how you're thinking and processing. So we use sophisticated robotic technology to see how you perform in a virtual reality space. We can look at your gait using an instrumented walkway. And so the naked eye may not see you walk any differently than anybody else, but we can detect impairments on it using our techniques. We can also use a technique called transcranial magnetic stimulation. It's a big word, I'll call it TMS. But what you do is you stimulate the brain with a magnetic coil, and that stimulus will follow down the brain, cross over to the other side to move your hand. And if that's damaged, we'll see a disruption in the flow of that. So when I say deep clinical phenotyping, there's not much we can't measure about human performance. And that gives us great opportunities to test lots of neat ideas, neat technologies, anything that you think can potentially affect the brain or the body, we can measure that. In many ways, the healthcare system probably hasn't changed that much in the last 30 or 40 years. I think health innovation means maybe new methods, new technology, new ways of thinking towards solving a problem that affects people. So we're really interested in technology and what we do. So we're testing right now an innovative tool called translingual neurostimulation. So you stimulate the tongue, this stimulates the base of the brain, which influences neuroplasticity and potentially recovery. We're interested in new ways to measure human performance, anything that improves the human condition. Our field is really that technology field and treatment field.
I'm a research assistant here at the Recovery and Performance Lab, and I'm primarily responsible for testing with the TMS. So we have a lot of folks with MS and stroke that are coming in, and we're trying to get a good sense of sort of how well the pathways from their brains to their muscles are performing. And so what we do is we have them sit in this chair here, and then we stimulate their brains. And so I'm responsible sort of for going through that protocol with them and then analyzing the data afterwards and sort of getting a good sense of how they're doing. I would say health innovation is, first of all, it's really important to me as a career thing because I specialize with a lot of these technologies, and so the more technologies that there are, the more chances, to sort of learn that and apply that to neuroscience and bring that to, the research side of things. And then obviously on the clinical side of things, those technologies then end up, becoming therapeutic, and they help illuminate which therapies are working better in ways that we can't test behaviorally, right? So just like how Dr. Ploughman was saying, a lot of this stuff is very sci-fi. Like, it's stuff that we never really thought was possible anytime soon. So just sort of seeing the ability to, as you'll see in a little bit, the ability to move someone's hand without them wanting to is pretty crazy. I think that health innovation is useful for both expanding human knowledge and then also applying that knowledge to improve people's lives.
I am a master's student here at the Recovery and Performance Lab, And I'm currently working studying mental fatigue in people with multiple sclerosis. So I am using something called functional near-infrared spectroscopy, FNIRS, to try to measure brain activation when people with MS do challenging tasks. We gotta keep moving and we gotta keep improving with new technologies. And I think in my case, by using FNIRS, I see how the impact of having a cheaper, more accessible way of measuring brain activation compared to fMRI. It is more accessible, more affordable. People can walk around and do it, and you can see what's happening in the brain at the same time.
I'm an undergraduate student here at the lab. I basically help everyone with all of their trials, studies, projects, their data collection, interpretation, really whatever anyone needs. When I first walked in here, Michelle, I guess, recruited me. I felt like, how am I ever going to do anything here? I have no idea what I'm getting into. And I grew, and it kind of just became like a second home for me. Like, it's just a second nature, and you just have to go out there and essentially knock on everyone's doors until they let you in. That's what I did, and I was really lucky that Michelle offered me a position here because I've learned so much and I've grown so much as a person. I would have never talked on camera before, and now I feel like I can actually sit here and, you know, talk comfortably with someone about everything that we're doing here. People come in and, I don't know, they can't move their arm this far, and after, you know, 2 or 3 months, they can move it and they can do it better than they ever could. And to see that reaction makes everything worth it. The late nights, all the coffee, makes it all worth it.
We are looking for collaborators. We would love to talk to companies that have really innovative ideas to promote brain plasticity, recovery, could be after spinal cord injury, traumatic brain injury, concussion, ways to test human performance. We're testing some innovative, actually through clinical trials, some innovative plasticity promoting drugs even. We're interested in people who do machine learning, artificial intelligence. One thing we do collect here is a lot of data. And there might be messages and knowledge within the data that we can't see because we're using reductionist methods to get to a mean and a standard deviation. Maybe there's something more there and we can't see it. So biostatistics, mathematics, those fields we're really interested in.